of exercise should you do after your brain injury? And boy, I wish I had known some of these things before I started exercising. But you need to exercise within your limits. And what I mean by that is the limits of whatever your physical therapist or your occupational therapist or your other brain injury specialists say. You could also have limitations based on what you can do for exercise if you have other injuries. And the other thing is monitoring your brain injury symptoms. So if your brain injury symptoms worsen when you exercise, then you're pushing it too hard, and you need to back off and kind of operate below the level of developing brain injury symptoms. So some of those symptoms that you'll want to monitor for are shortness of breath, rapid heart rate, fatigue, exhaustion, pounding headache, or worsening pain from any of your other injuries. This is when you know you're pushing it too hard, too fast. Like I said before, you want to exercise kind of below those symptoms. You want to exercise to the point where you're not pushing yourself to developing those symptoms. However, though, as you recover and as time passes, there is going to come a point where you're going to want to push it a little bit to expand your efforts and your abilities. And so really sometimes what it comes down to is finding the balance that works best for you. Pushing it when you feel good, pushing those boundaries a little bit when you feel good, and staying within those boundaries on the days that you're not feeling great or it's just a bad brain day. So your goal is to be active most days of the week. When you return to exercise, you want to do it safely. So avoid any impact sports or rapid response sports early in your recovery, anything with quick movement, until your reaction time has returned and is back to your baseline. And not only your reaction time, but your cognitive speed also, and your balance and your walking difficulties have resolved. So no dizziness or vertigo. Get cleared by your general practitioner and therapist and a vision specialist too if you're going to return to any sports, because you want to make sure that your eye-hand coordination is intact and hasn't been knocked offline after your brain injury. Now, having these limits totally sucks, and I am totally there with you. One of the things that I had to give up after my brain injury was snowboarding. I didn't have the capacity to make quick judgments. I didn't have good connections between my brain and my body, and I really couldn't afford another concussion or head injury. So I did give up snowboarding, but there are some activities that are safe for individuals with brain injuries. And so the best thing if you don't have any walking issues or balance issues is just to start walking. Other things you can do is swimming, yoga, gardening. If you do have balance issues, you can consider chair exercises or chair yoga, utilizing walking sticks or recreational walking sticks when you go out on your walk. And when you're planning your exercise or your return to exercise, make sure when you're early in your recovery that you make your physical therapy and occupational therapy exercises, your visual therapy, speech therapy, all those therapies. Make sure you make them your priority to get those exercises in at the recommended frequency and interval by your therapist. That is your priority early into recovery. if especially if your energy to do exercise is limited, because it can be tiring after a brain injury to try and do physical therapy exercises, and then try to do walking afterwards. Make sure you make those exercises from your physical therapist, occupational therapist, your a neurotherapist, a priority first. Get those down and integrated into your lifestyle, because you're going to be doing them a lot over the next several months, maybe even the year. And then as your energy levels increase, then you can start adding on the other exercises